Good afternoon, everybody, and welcome to the final breakout session for this afternoon. We are going to be talking about future-focused equity agenda setting, specifically as it relates to a health equity future. As you've heard for all of this morning and earlier this afternoon, promoting health equity requires us to directly face and address underlying socioeconomic inequities across all the key drivers of health. Knowing that building a healthy community has benefits that extend well beyond traditional notions of health alone, creating equitable opportunities for health in the District of Columbia requires multiple sectors working collaboratively, each doing their part to improve health outcomes. And so in modeling that collaborative practice, I've invited some of my colleagues. Right now, right next to me, I have Tommy Wells, Director of the Department of Energy and Environment. And online, I have Director Delbert McFadden, who's the Director of the Office of Neighborhood Safety and Engagement. Unfortunately, our other colleague, Delano Hunter, Director of DPR, is not able to join us. He had an emergency or a family emergency earlier today. So our thoughts are with him. But we will carry on the work. We are troopers. And with that, I'm going to ask Director Wells to introduce himself.
Well, hello, and thank you very much. I'm very pleased and honored to be here with you, and how thoughtful to have this forum to talk about equity futures at a time when we really are hopefully coming out of a pandemic, but certainly where we have a year to a year and a half of learning of impact of a stressor like that. So I'm Tommy Wells. I'm your director of the Department of Energy and Environment. And we're an agency that protects the land, the water, and the air. And we also try to be sure that we have a smart energy future, that we deploy solar, we support people with their power bills, their energy bills. We try to create energy security for our city. And I'm also the chief head of the Urban Sustainability Office, meaning that we have to have a sustainable city, and especially this time with climate change and other stressors that we experience, my job is to be sure that our city is resilient and sustainable, along with my colleagues like you.
Well, thank you so much, Tommy, for that great introduction to DOEE. And Del, why don't you tell us about the Office of Neighborhood Safety and Engagement, and introduce yourself first, of course, and then tell us about your agency.
Of course. Thank you for the introduction. My name is Delbert McFadden, Executive Director for the Office of Neighborhood Safety Engagement. The office was created in 2017 to enact neighborhood engagement achieve results. We are Provision 1A, which to date states that we are to work with the most difficult high-risk population here in the District of Columbia. What that means, we call them Tier 1, Tier 2 individuals. Those are individuals who playing a role in some of the issues around gun violence, or those who are victims of violence. We have 6 different programs here in the Office of Neighborhood Safety Engagement. Most popular is the violence prevention and intervention work that we have across the city. We have 3 contractors, collaborative solutions for communities in wards 1 and 4, training grounds in wards 6 and 7, and Far Southeast Family Strengthening Collaborative in wards 8 and 5. And they respond to shooting incidents here in the district. We also have a family support services program that responds and support families impacted by homicides here in the district, every homicide and non-fatal shootings. To date, they've seen over 422 cases year to date, unfortunately. And so we're very alarmed about the uptick in the numbers of incidents that's happening here in the district. We are seeing some incremental changes and reductions in our 21 communities that we work in. And so we're here to do the work. We're excited about the work, and we know that the only way that this happens is through true partnership. All of the government agencies, government as a whole, the private sector, and the community. One of the things that I've learned in doing this work is that communities do not want you to bake that cake for them. They want to be part of the strategy. And I think that's the best way, because they take ownership in it and they find out how to empower themselves. So even absent of government, they can run their own communities. And that's the way that it should be. They can govern their own communities and make sure that voice and make sure that they have everything that they need, not to just duck bullets, but to thrive. This office supports communities so that they can thrive, be stabilized, and have everything that they need to be successful and join the larger society.
That is great. Well, thank you so much, Director McFadden. And as in my enthusiasm to launch this discussion, I omitted to say that I'm Anneta Arno. I'm the Director of the Office for Health Equity. I did give a really high-level overview earlier today that really talked about the work that we've been doing here in the Office for Health Equity since we were launched, including working on violence prevention and some of the pre-work that came before the launch of the Office for Neighborhood Safety and Engagement. What you'll notice as we have traversed the conversation today from this morning through to now, we've talked about how we plan in the long term. We talked in the first breakout session also, in the second breakout session earlier this afternoon, on how we work directly with people, what it has taken for us and what we've learned during the pandemic. And now we're really talking about the broader outdoor and community environment and ensuring that we are safe. So our community, in fact, community is all of us. So there's both the community of people, but there's also the community of the environment. And we are stewards of the community and our brothers and sisters keepers. So with that, I wanted to ask you about how, in the first question I'm going to pose to both of my colleagues here, understanding that health equity is everybody's work. What big, bold moves have you made or are considering making to drive transformational change in your work and across your sector? Include in your comments any barriers that you face in efforts to drive change and contributing to the vision of DC as the healthiest city in America. And with that, I'm going to ask Del to take that first question, and then I'll flip over to you, Tommy.
Yeah, that's so very important. Thank you for that question. One of the things working building blocks in the Office of Neighborhood Safety Engagement to reduce violence here in the District of Columbia, utilizing best practice and evidence-based practice that we've learned for other jurisdictions and work that's been done here for years. One of the things that we have to understand, and I think the current city administrator said it best, specifically for this population and communities of concentrated poverty and high violence, is that what we need does not exist. And so the effort of the EOC and building blocks was built to look at government as a whole so that every government agency, I don't care if it's DMV, DC Public Schools, whatever that agency is playing a role in reducing violence here in the District of Columbia. And so we have a lot of challenges when it comes to this very small population of individuals that's playing a role in violence. It's a very small population. However, I don't think we've mastered tailoring the services and supports specifically for that population, because it takes relentless pursuit. It takes being consistent. And it takes being able to meet people where they are. So I think those are the bold moves to start it. And later on, I would definitely talk about some of the investments and moving forward. We've had a lot of challenges. Director Linda Holly Harper has been to the table with us and assisted us in addressing some of the challenges that impeded upon us being more successful with this work and with this population.
Okay, great. That's wonderful to learn. So, Tommy, let's hear from you. What are your big, bold moves?
Well, what I've learned through this pandemic is that for our city to be resilient and be able to respond to whether it be a health crisis or any other type of crisis, you have to have diversity. Now, in the environment, we all know that. We know that if Monsanto grows just one kind of corn and something challenges that corn, you lose a major part of the food system of America. We used to be a city of trees, and they were all elm trees. And then one disease comes in, Dutch elm disease, a beetle, wipes them out, and all of a sudden we don't have trees. You have to have diversity for strength. That means, that's the metaphor, but that also means that you have to have a workforce that is diverse of all income levels. If your metro goes down and public transit stops, where are your healthcare workers? Where are the people that come in that we count on every day for home health care, for our hospitals, for our centers that help support us to keep us healthy? You lose diversity of economics income groups in the city, and the city's lost its resiliency. We look at downtown. Downtown was built for office workers. And so what that means is that almost any restaurant or other economic activity is dependent on office workers. Office workers don't show up. You have an empty downtown. We've lost about almost a third of all our restaurants downtown. People were put out of work. It impacted the economics of our city. So the first thing that we learned coming out of this pandemic, we have to have diversity to have a resilient city. And that means for all of us, that is where we create resiliency. The second thing that we learned was how important nature is when you're stuck, at home, and what it did to our mental health to not have, we thought about what do we lose by not interacting with other people as much, but also what do you lose by not getting outdoors into the environment? So the National Park Service, we have more parkland than any other city in the country, and they shut down during the pandemic. You could not go to the national parks. So the mayor kept the park that she created at Kingman Island open. You could walk out and get by the water, look out and see trees, wildlife, birds. And we had so many children, families, elderly of all levels walking out onto Kingman Island to be outdoors for their health. And that's in an area where we have some pretty poor health outcomes, that part of Ward 7 in particular. And what we know is that we have to have people to have the capacity to walk out to parks. It's why Parks and Rec is so important. It's why trees are so important. We know that mental health and health outcomes improve directly in relationship to how many trees you live around. And so I know going forward, we're going to continue to plant trees. Under Mayor Bowser, we're planting over 11,000 trees a year. Now, you got to go out there and water them, and you got to keep them alive, just like we do with people. But it's an important way to create a diverse environment that's equitable for everyone.
Thank you so much, Director Wells. I think some of the things that you said that ring through. We referenced the importance of blue space and green space in our health equity report. And we don't have Director Hunter here, but I know that one of the things in their surveys as they were producing their Ready to Play master plan, which I suspect you had a little bit of was that they noted during the pandemic was that, yes, they'd spent a lot of time looking, and I'm not saying they didn't do outdoor environment. There was a lot of emphasis placed on building rec centers and all of those kinds of things. But of course, we had to close them during the pandemic. And so it's really underscored the importance of the outdoor environment. I, for my part, know that we had our Healing Futures Fellowship folks this summer. And where did we take them during the pandemic? To Kingman Island. So thank you so much for all the work that you're doing in that regard. So now I have, we're still waiting. Hopefully we'll have one other panelist join us. But now I've got a few questions that I'm going to pose directly to each one of you. Director Wells, DOEE has a demonstrated strength in environmental leadership, nationally as well as internationally. What are our greatest local challenges in terms of environmental health in the district? And as the regulatory agency in DC, how does DOEE work to address these challenges in the immediate as well as the longer term? And what specifically are you doing to ensure the application of an equity lens? As you talk about that, tell us also some more about, are there any international best practices that you are bringing back to our hometown?
That's a great question. And let me say that about 4 or 5 years into Mayor Bowser's term, we were named the first LEED Platinum city in the whole world. That's how much work we did together with Mayor Bowser's leadership to we're a city that is and has set a standard not just for the nation, but in many things we set the standard for the world. And I can't say enough about that. Going forward, how do we meet the goals of not using so much electricity? Because most electricity is powered with coal, with natural gas, with oil, and those are the things that shorten lives because of the air quality in our region. It may be generated in Pennsylvania, but it blows down here. And how do we use less energy, and how do we promote health? And something that I know Dr. Nesbitt and I worked on when I was a council member is, how do you have healthy buildings that create healthy lifestyles? How do we get people to have a neighborhood where they walk? We want, and we're doing this under the mayor, we want to have grocery stores, drug stores, kind of places where you walk there instead of having to get in a car. So when our seniors and children will walk to the amenities in their neighborhood, they use less energy, they don't burn as much fossil fuel, and they get the health benefit of walking. And I know at first it was a little controversial of why all these bike lanes. Well, the more that we get protected bike lanes in the city, we have more seniors and more children willing to ride a bike to school, to work, to a doctor's visit, because they're protected in that lane. And our city is finally beginning to lead in that, and I could not be more proud of our Department of Transportation of those assets. So to meet the challenges of health equity, we have to create safe passageways for people to walk to the amenities that they want. If you don't feel safe, as Del knows, then you're going to get in your car. But if you feel safe, you will walk there. And we want everyone, no matter what your status is, to be able to do that. So what we're doing on equity and inclusion, it used to be we would say, all right, what about diversity? And as you know very well with your work, that became just a numbers game. Oh, how many women, how many this person, but are you really diverse? Then we started talking about equity. And we all know the picture of the kids watching the baseball game. Equity is which size box according to your capacity and height. So equity is part of DOEE, that we everything we do has an equity overlay. But we also learned, especially through Black Lives Matter, through the pandemic, is the importance of inclusion. It's one thing to say, oh, no, we're going to be equitable and we'll be sure everybody has the same thing. But if you're not part of deciding what that thing is, then is it really equity? So we have 4 guiding North Stars for our strategic plan for DOEE. And each North Star has equity and inclusion in it. It's not a one-off. It's not like its own North Star. It's part of our DNA. And we have to get there. And I think the last thing I'll note about that going forward is that we no longer contract out stakeholder engagement in communities. Because why would you buy that capacity instead of create the capacity? I mean, that's part of what you do here. And Dr. Nesbitt has been a model through your work to show that inclusion should be something that your staff, it's part of their jobs. We had a contract go out. They put in the contract stakeholder engagement. And I said, that's wrong. Why'd you do that? And they said, well, we just don't have time on our job to do it. And I said, well, then maybe it's not the right job for you. So equity and inclusion is about who we are in this government. And it needs, and again, with your leadership and Dr. Nesbitt's leadership, it really sets the path to say, we need to have that expertise inside of our organization. It's not something you buy.
Excellent. Great answer. And Del, I've got a special question that we designed for you. In applying a public health approach to violence prevention and promoting community safety, how important has it been for you to shift from traditional models limited to compensating for the impact of inequity to more systemic change that disrupts the status quo through policy and practice change? How can all of us, and I think this is really an important part of it, how can all of us tuned in today join in the efforts that you are leading for our city?
Well, I think there's a couple of things. Thanks for that question. And I stated it in the opening, is looking at government and seeing where there's challenges with getting this small population the services and supports that they need, from housing to job training and employment, really understanding that we work with individuals who have a criminal background, so they're returning citizens. How do we work with businesses and government to relax some of the criteria for employment? How do we relax some of the criteria for housing? And so those are some of the things that we're working on as a whole of government to get done with this very small population. How people can join in is supporting us with some of the things that we need is that job training piece. We have career tracks here at the office and push entrepreneurship with this small group of individuals that we're working with. Also referring key individuals to the ONSE Office of Neighborhood Safety Engagement that you feel are in harm's way or out in the community creating some of these situations. I think the bold and thing that we're doing now and is changing the game is being prescriptive to the communities where the communities, not just the violence prevention and intervention work, but talking with the pillars, the ANCs in the communities to really come jointly develop a strategy to address a lot of the issues in the community. And that's very important to have that feedback, to have that partnership in the community, because the assets, the jewels, and the community is so resilient. So I think as a whole, planning together and making sure that we strategize collectively so that we're not duplicating efforts is so important. So the coordination of our efforts is important as well.
Thank you so much, Del. And I'm really delighted to say that we finally have Kishia Powell, Chief Operating Officer from DC Water, join us. Hello, Kishia. How are you?
Hello, I'm good. I'm hoping you can hear me.
I can. And so what we did was we asked each of the current panelists to introduce themselves quickly. And so you can just talk a little bit about what your organization, about yourself and what DC Water does for our city. And then I'll follow up almost directly with you in a specific question that I have for you.
I'm Kishia Powell. I'm the Chief Operating Officer for DC Water. And my responsibility includes all of the operating departments, including our operations and engineering teams and our linkage between water and health equity. One of the programmatic initiatives that has been underway this last year is a challenge that has allowed us to crowdsource expertise so that we can develop a district-wide portfolio of clean energy or renewable energy projects, which allow us to be on the mitigation side of climate change, which we know directly impacts our neighborhoods and communities. So when we talk about the social determinants of health, making sure that DC Water is in a position to ensure that we have water access and affordability, that we are doing our part to address any financial stability concerns. And certainly that comes when there are concerns about affordability, making sure that folks are living in safe communities. So addressing flooding, DC Water is working with DOEE on a flood task force. So we'll be identifying measures to address that. Also making sure that there's access to nature. So our part is developing more green infrastructure in coordination with DOEE as well. And then I believe another social determinant that we can impact is affordable and nutritious foods by doing our part to uplift the district's focus on urban agriculture. And then certainly addressing those things that we have direct control over, like partnering with the Department of Health whenever there is a concern about Legionnaires. We're focused on contaminants of emerging concern to make sure that we're always providing safe and healthy drinking water. And then other initiatives that are focused on climate resilience.
Okay, that is wonderful. What a long list of bold moves. So I'm very, very impressive. And you mentioned the new flood task force that is being co-chaired with our very own Tommy Wells sitting next to me. In launching that flood task force, City Administrator Kevin Donahue said, flood events and water damage will be more frequent and severe in the future due to climate change. And most of the areas, and this is the part that I underscored, most of the areas in the district that are known to be at risk of flooding are inhabited residents that are vulnerable and economically disadvantaged. So I'm going to ask you, Tommy, a little bit to respond to that particular comment, and then we're going to talk some more about this particular task force and what its promising practices look like.
Well, first let me say that, as Ms. Powell noted, is that I'm the chair of DC Water as well. And from that role, I have to say that we're so fortunate. Ms. Powell is probably one of the best administrators I have ever worked with in the country. And DC and our region is so lucky to have her leadership. You heard her talk about a vision that was much broader than what you expect from your sewer and water authority. It talked about health security, food security. She talked about the overlay of equity. She talked about so many different things around energy and mitigating. I mean, a lot of people don't know that your sewer and water operations are often the largest user of electricity of any single user. And so the kind of responsibility and stewardship that Ms. Powell is talking about, leading DC Water to being better stewards, is DOEE and the mayor, we could not have a better partner, and I'm very proud of that. So with flooding, it's a whole new world with climate change. We used to worry about having, tidal rivers that when a hurricane came, pushed the rivers up on the banks, and then we'd flood. And you'd see Haynes Point. We've all seen how that goes underwater, portions of that related to sea level change and flooding. But what's new is the flooding on the interior of the city. We had a national weather alert a couple of years ago for the first time. You get a national weather alert when there's threat to health, safety, and welfare. And that was our first one. And we saw pictures of people standing on top of their cars, like we've seen in other areas, like New Orleans, people standing on top of their cars because they were flooded. And then on September 10th of this past year, that we had flooding, again, interior to DC, low-income residents that are renters. They don't think they have flood insurance. They lost, their carpets, their rugs, their furniture, and it's not easy to replace. And DC Water came in to help, but what it became clear, and Kevin Donahue as CA has articulated this well, it's not just DC Water's responsibility. They can't handle every big rain, and they can't reimburse every resident for damage due to rain. It has to be Department of Transportation to channel water through the city to get it back into the rivers. We have to have our insurance folks help us figure out what products we need to help lower income residents, and especially renters, insure so they don't lose everything. And we also have to figure out how to retrofit our built environment. As I've talked with Mr. Hunter, some of our parks have to drop down 4 feet so they can hold water until it stops raining. I mean, it's pretty basic. But I will also note that DC Water is creating almost 20 miles of tunnels underneath the city, paid by the ratepayers, but it'll be at least $3 billion with interest. But 100 feet down, the size of metro tunnels to hold water so that it doesn't overflow sewage into the rivers. But the added benefit is that when you have more rain than the land can handle, it'll go down there. So we just opened the first 7 miles under the Anacostia River, 7 miles following the river 100 feet down. And they are going to continue. And last thing I'll say about imagine having that kind of capacity of 20 miles of metro tunnels just to hold water to help prevent flooding. It's that it's an incredible investment, and have to say that our ratepayers are paying it. So the city is taking care of these needs. We have a lot more work to do, but the Flood Task Force is very broad of how we protect our citizens.
Great. Well, Thank you so much. So, Kishia, now that I know it's relatively recently that the new task force was launched, but I wanted to, and I know Director Wells has mentioned a few things. What are the promising ideas that have emerged thus far that you're pursuing, in addition to what Tommy has mentioned?
Well, I think that just having a collaborative task force with more than, I believe it's 13 agencies working together from across the district on this one issue, to look at how all of these agencies can help develop solutions is the promising idea that has emerged so far. I think we've had a limited number of meetings, but we've laid out several action areas from governance to more specific things like mapping and modeling and implementation of the backwater valve program, a program that we expanded after the September 10th.
Explain the backwater valve
that
program.
Allows us to, I'm sorry, that's right, where we expanded an opportunity for properties, residents to have support or financial assistance to a lateral, the pipe that connects to the public sewer, so that if there were to be a backup, it would not enter their property. Because we understand that for every 1 inch of standing water in a structure, FEMA has estimated that there's $25,000 worth of damage. So when we talk about residents that are vulnerable and economically or most vulnerable and financially vulnerable to the impacts of climate change, we're talking about folks that can't afford $25,000 worth of repair when there is a backup. So for, that a few $1,000s, we can help put a measure of protection in place that would prevent that interior or that backup flooding. The partnership between DC Water and DOEE invited us to participate with them in an integrated modeling exercise, where for the first time, I think we will have an integrated model that marries the pipe system with the natural system, so that we can actually see areas that if they were to flood under certain conditions, we'll be able to see where that is and what the impacts would be. Mm-hmm. I think having that information at our fingertips to drive decisions on investments that we make in infrastructure or other types of investments and policy changes will be very powerful for us.
Okay, that's great. You've actually anticipated the next part of my questions. What opportunities do we have to prioritize and leverage with the new infrastructure bill?
Oh my goodness. I think I actually just had a lunch and learn today on the infrastructure bill with the team, and it was really good discussion. This is historic levels of funding for the water sector. There are so many buckets of funding that we can tap into, including a bucket for climate resilience. But we know that one of the things that this administration wants to maximize under the use of these funds is climate resilience in specifically disadvantaged communities and those communities that are most physically and economically vulnerable to climate change. We know that. We also know that they have prioritized having more grant funding for under the infrastructure bill. So we are looking forward to, as we identify project opportunities to address flooding, that we would be able to pursue on a competitive basis grants under the climate resilience bucket, and even hopefully partnering with DDOT to pursue funding under the surface transportation portion, because we know that was half of the funding in the infrastructure bill is under transportation, and that there are some programs there that I think we can pursue that will address the flooding issue, more green infrastructure, other capacity relief solutions. As Director Wells talked about the tunnel system, there's just more that we can do on the local sewers and communities that will help with the flooding issue for sure.
Okay, that is great. I cannot believe that we've got to the point where we have 9 minutes left on this panel. I've got a couple or 2 or 3 questions from the audience, and I'm going to invite everybody to engage in developing the answer. We've been talking a lot about the environment, the outdoor environment. So I'm actually going to pitch this one. Everybody's going to get to answer the question, but I'm going to pitch it first to Del McFadden. And so the audience question says, what is the best way to authentically engage communities around issues of equity in agenda setting?
I think in the most organic way, creating avenues where you can listen to the community, whether it be stakeholders, ANC commissioners, residents, really sitting down and creating an environment that's conducive to getting those ideas and having a way to implement those ideas as much as possible. So resources are very important. Building those relationships. And as I stated, being consistent so that we could get that information from the community. Some of the bold things that we are now doing for FY22 is going to these communities and sitting down and just listening, having multiple sessions where we listen, where we identify the gaps in the communities and use government as a whole to address those gaps. So I think that is a way that we could utilize in getting that feedback from the community and then making sure we have the resources and the strategy to push those things forward.
That's great. Tommy, I think when you were talking earlier, you talked about how you're trying to transition engagement in your office. Do you have anything to add about authentic engagement of communities and agenda setting specifically?
I just want to kind of echo and reiterate and highlight what Del just said. That was very important. And the reason that it's important about listening and being present to the community is that it's different from how government often works. We still have government folks that say, we've written a plan and now we're going to go out and get everybody's input. That's one of the most unempowering things you can do to a community is, here's the plan, we want your input. What Del talked about is, let's go out and listen and understand where we're interacting, that what will be the impact of this and what's something we didn't think of. How does this community work? And it works differently, sometimes 2 blocks away from another place in the city. Mm-hmm. So there's no like, oh, this is a best practice, so this is what we're going to do. What Del said is very powerful, and I don't want to lose that because that's what I have to do with my agency, is to understand that it's not we write a plan and get people's feedback. You have the community part, the inclusive, and the part of actually writing the plan.
And I wrote down what Del said, listen and being present. So that's really critical. And so, Kishia, the second question, the 2 questions that came are both related. In fact, it sounds like folks are very much into how are we going to engage folks. The second question actually says, how do we engage young people in building an equitable future?
Well, I have to agree that point about listening and being present can't be underscored enough. When we talk about equity, we're talking about outcomes, and the only way that we can understand what outcomes would best serve or what outcomes a community does.
Looks like we're frozen a little bit.
Those, and then incorporate that into the work that we attempt to do. And I think our youth directly engaging them and meeting them where they are, understanding what messages resonate with them, but also understand how youth want to be, how the younger generations want to be engaged. What has worked for us in terms of training, learning, educating, and inspiring is just different for the generations that are coming up today. And we are trying to be more in touch with what that is. We're trying to understand, even from a workforce development perspective, because we're trying to draw more young folks and generations into the water sector, but understanding how they want to work moving forward. And I think that the pandemic has been a great view into how things will change as we move forward, as we engage the younger generation.
That is great. I think you've touched on something that is really important, and I did not specifically include a question like that, but I'm going to ad lib with the chair piece here. Workforce development, I think, is really important, and I know Director Wells, you're leading a lot of our green jobs programs, and I'm hearing that you're doing some stuff in water. And Del, I know jobs are a major part of the solution in your arena. So I'd love to first hear from you. What is your thought about engaging young people and thinking about the new nature of work? How does that fit into your agenda and agenda setting in particular?
No, I think it's extremely important. We have to role model, and we have to have legitimate opportunities. The way that I look at the ONSE office is like the Ford Motor Company back in the day. You know, there's a conveyor belt, and each section through the conveyor belt, something is added. We want young folks. We want our young ambassadors that come through the Pathways program. They have a toolbox. We want to constantly put things in their toolbox where we know they'll be better off, more employable, be able to go back to the community, be law-abiding citizens. Restorative justice plays a part in giving back to the community. So that is a critical part of this work. And we know one of the mayor's saying is a pathway to the middle class. We are serious about that statement. We have numerous guys. We probably touched over 160 guys through our Pathways program. And we have more than 50 of those individuals who are returning citizens gainfully employed. Some work in 6 months or better. And guess what? Our conversations with them is no longer about a firearm. It's about, I'm about to start a new job. I just bought my own place. I'm having a child. I bought a new car. And that's where we need to help individuals once we're able to get them stable. Another one of the pieces is trauma. Some of the things that we're doing with the funding that we're getting $16 million in federal stimulus dollars for FY22 budget, going from 10.3 to $28.6 million. And we've learned very quickly with our first Pathways program on the mental health issues. And so we're utilizing community wellness ventures to provide cognitive behavior therapy and trauma-informed care. And the thing that's different about it is culturally specific, and the staff is culturally competent. They work with our Pathways guys. I've never seen guys, the population that we work with, ask for therapy 2 and 3 times a week, unheard of. And that's because they are culturally competent, know the language, and able to meet individuals where they are. So that's so important.
Wow. Well, that is fabulous. And I'm going to pitch it to you, Tommy, to close out the floor. We are at time, but we did start a little bit late, so we're going to do it.
My former colleague, Marion Berry, we served on the city council together. And whenever DC Water, Pepco, Washington Gas, or Metro, WMATA came in front of us, Marion would say, "What are you doing to hire our residents from Washington, D.C.? And how come I don't see more of our residents being hired?" And so he asked that every single time, and I learned how to ask that as well and to expect it. What Ms. Powell touched on is that DC Water created a pathway that young people or of any age can come in as apprentice and get into one of the best careers in the country. Full health care, great, pay scale and union protections and all the benefits that come with working with your water and sewer authority. We have so many of our employees have been with us forever because it's provided a great life for them and their families, sending their children to college, having the money they need for the middle class, at least, if not better, that the mayor often talks about. But we have a lot of people retiring, especially through this pandemic. And so we have to do even better. And so I know DC Water is, but we all have to do better. And I promised to Del, when I was on the council, I wrote and passed the law to ban the box. The barriers that we have to hiring people. So what's the box? The box is, have you ever been arrested? Have you ever committed a crime that you had to, one level of another, been incarcerated? As soon as you check that box, they just pass over you for that job. In DC, unless there's a direct nexus to that crime, you cannot ask that. But we have to do better. I know that there's barriers to WMATA in terms of what your history has been. Even though people have done time, they've put investment in themselves, they're taking therapy, they're great productive folks that we want back in the workforce. We have to remove more of those barriers because some of those limits don't make sense. But that's we have a good history of asking that question. Why aren't you hiring more residents? We've got to have a better history of answering the question.
Okay. Wonderful. This has been tremendous. I would love to hear from you, Ms. Powell, but I think we're out of time. The good news is that this is just a starter conversation. I am planning to I've been talking with most of you along the way, but this is just the start of how do we build back our city to something beyond what we could have even dreamed about before the pandemic. So I want to stay here and thank you, Kishia Powell, Director McFadden, and Director Wells. To the audience out there, I thank you profoundly for sitting with us and listening to the conversation this afternoon. More than anything else, I would like you to know that we have a 5-minute break planned. This time it's only 5 minutes. We don't want to take all of your time for the rest of the day. We're still hoping to close the summit out by 4 p.m. today. And we will come back, myself and my colleague, Dr. Amber Hewitt, will kind of come back and talk about what we have heard today and how and I hope like me, you all feel buoyed up by what you've heard today and all of the opportunity, because some of what we heard today, I may have had a few questions, but a lot of things came out that I did not anticipate. So I want to thank you profoundly, Director Wells. I want to thank you, Del, for bringing up the idea of we're not talking about a firearm. Imagine that. And thank you too, Kishia. So without further ado, I see my minder telling me we got to move on. Thank you so much, everybody.
Thank you.
Thank you.